Oh my God, they won't let it go. Even though it's a long shot, some Republican senators still think they can bring a repeal and replace bill to fruition before the end of the month. This Hail Mary pass is known as Cassidy Graham, and this is Healthcare Triage News. Last week I said repeal and replace was dead, and I still think it's mostly dead, but not everyone agrees, and we want you to be informed. You may remember Senator Bill Cassidy, Republican from Louisiana, from our episode on his last foray into healthcare reform, the Cassidy-Collins bill. This time he's teaming up with Senator Lindsey Graham, Republican of South Carolina, and Senator Dean Heller, Republican of Nevada. Although Heller isn't getting named credit. I wonder if that annoys him. Or maybe it pleases him, I don't know. Anyway, this proposal basically turns over control of the ACA to each of the states. They don't get a Medicaid expansion subsidy, nor do the people living in those states get any subsidies directly from the government. Instead, the states get a lump sum payment, a block grant, if you will, which they can use to develop any system they want. If states like the ACA, they can just keep it going if they have the money. If they like something else, they can do that. They can take the money and use it to subsidize people differently. They could create high-risk pools for the sick. They could even spend the money on other programs, I guess. Don't like the individual mandate? Great, because it's gone, unless your state puts it back in. Same with the employer penalty. Cost-sharing subsidies go away in 2020 unless states choose to continue them. Remember how the ACA says insurers can only charge older people 3 times as much as younger people? Like other Republican proposals, Cassidy Graham says it can now be 5 times as much. But it also says states can overrule that, so I don't know. Oddly, Cassidy Graham seems to still forbid insurers from refusing to cover people with pre-existing conditions. But it allows some leeway in what insurers have to cover for those conditions. The bill also allows states to change how they define an essential benefit. Planned Parenthood gets a 1-year Medicaid funding freeze. Why? Why 1 year? I don't know. And like other Republican proposals, it would switch Medicaid to a block grant in 2020, and let's pause there. Of course. As with any block grant, the fiscal magic is just cutting it in the future. By 2020, funding for the Medicaid expansion will be cut by 1/3. In 2026, it goes away completely. Supporters of the idea say that this will force states to be innovative and efficient. We've covered this so many times before. There's no magic. There's no secret innovation. If there was some kind of magic solution by which states could simultaneously increase access, decrease spending, and improve quality, they'd do it right now. And you should know this, the bill would hit states that have most aggressively used the Affordable Care Act, blue states, the hardest. They've expanded Medicaid the most. They're the ones who have signed up the most people to exchange policies. And the bill would divide up the Medicaid money among all states equally, regardless of whether they've expanded Medicaid. Texas will make out like bandits, California will get crushed. And the equation it seems they're using to calculate the block grants favors more sparsely populated states than those with dense urban populations. Red states. But this is all conjecture. We still haven't seen a bill, just bullet points and press conferences. A bill could come out today, but a bill needs to be written. Then it needs to be scored by the CBO. Then it needs to be approved by a Senate parliamentarian. Then it would need to be considered. Then it would need to be brought to the floor. Then it would need 50 votes in the Senate. And people in the Senate really want to work on taxes. Rand Paul seems like a hard no. I can't believe Collins and Murkowski would vote for this. It's still mostly dead. Healthcare Triage is funded in part by viewers like you through Patreon, a service that allows you to support the show through a monthly donation. Your support makes this show bigger and better. We'd especially like to thank Joe Sevitz and Sam. Thanks, Joe. Thanks, Sam. More information can be found at patreon.com/healthcaretriage.